बिस्मिल्लाहिर्रहमानिर्रहीम इय्याका नअबुदु व इय्याका नस्तईन अल्लाहुम्मा सल्लि अला मुहम्मदिन व अला आलि मुहम्मदिन व बारिक सल्लल्लाहु अलैहि। Dear colleagues, I am Dr. Sultan Ayub, working as a radiologist. This female patient, almost 20-year age, with history of heavy PV bleeding for the last 1.5 month, and there is no cure of bleeding in spite of the medicine. She is unmarried, so I am going to scan the pelvic region to examine the uterus. Here we can appreciate this is the cervix, this is the urinary bladder. Echogenic area is seen within the cervix. If we apply the color, look here, the vascularity is present at the periphery, while this echogenic area is not showing any blood flow, and this vessel is not going towards this echogenic area. Look here, so this echogenic mass, we can say, or area is present within the cervix of the uterus, and this seems to be the blood clot, as the patient is giving history of heavy menstrual bleeding. So now I'm going to focus the uterus. Just keep in mind that this patient is unmarried. Here we can appreciate this is the uterus, and here we can appreciate the anechoic areas or spaces that are coming from the myometrium at this fundal region level, and then these spaces are dilated channels are extending towards this area. This is the endometrial cavity or uterine cavity, and look here, this one, we can clearly appreciate these channels, these anechoic spaces. And look here, this is the endometrium, this is going here, and look here, we can appreciate this area. I am going to zoom it so that we have better visualization of this. So here we can appreciate this is the uterine cavity, endometrium, and look here, this is the anechoic channels or spaces starting from the posterior myometrium at the level of fundal region, reaching toward the uterine cavity or endometrium, and look here, entering into the uterine cavity, and look here, this is the echogenic area, and so we are now, look here, this is the endometrium, which is of normal thickness, and look here, these are starting from the myometrium here also, and then they are penetrating the whole myometrium, entering into the uterine cavity, and then it is touching the endometrium. So now I'm going to put the color. What are these areas here? Here now we can appreciate that these anechoic channels are the vessels, vascular channels, and they have color mixing, mosaic pattern, means they have turbulent blood flow. So turbulent blood flow, these anechoic spaces are actually the vascular channels. In a patient, 20-year unmarried patient with history of PV bleeding for the last 1.5 months, while she has a menstrual cycle history of last 6 years with no history of such heavy PV bleeding during the past years. So now I'm going to see the velocity of these channels. So we can appreciate that the velocity of these channels is more than 40 centimeter per second, and so we can appreciate that these vessels have different velocities. And also I am now going to see the velocity of this is the venous channel, and this velocity is 28.5 centimeter per second. So normally in an unmarried patient, such velocities are not too much high as we have seen in this patient. So this is the turbulent flow with high velocity venous channel as well as arterial channel. So both channels are present. So in my opinion, this is the case of congenital AV malformation, arteriovenous malformation. So question arises because we have come to know that in many cases that these AV malformation is mostly acquired due to the curettage, some cesarean section, but this patient has no such procedure in the past up to this time. So we can say clearly that this is the AV malformation, congenital AV malformation. And how these occur given during the embryologic life. Actually, there is a capillary bed between the arteries and the veins. We can say that arteries, then arterioles, then capillaries, then venules, and then veins. So this is the normal channel in the vessels. But when there is a failure of formation of capillary bed between the arteries and veins, then this arteries and veins communicate with each other with no capillary bed, due to which the pressure within the arteries as well as within the venous channel is increased. Blood flow, blood velocity is increased, and as we know that venous channels are very thin walled, so when arterial blood will go into the venous channels, these vessels can be further thinned due to the high pressure volume of the blood from the arteries, and then these channels which are entering into the endometrium, here the fragile veins which are present at the endometrial level or endometrium, and during the menstruation in the normal period, these fragile veins rupture due to this high pressure blood flow from the arteries to the vein, and then this heavy menstrual cycle can occur, or heavy PV bleeding can occur in such congenital malformation. Here we can appreciate mosaic pattern, high venous flow, high arterial flow, which should not be in the arcuate vessels. These are the arcuate vessels in the myometrium, so these should not be. So why this can happen in the unmarried patient that remains silent for years? Mainly these remain silent for years. However, when this occurs, this is mostly due to the hormonal changes which gradually go on changing, and also the estrogen level can also affect these vascular channels. Even menstrual cycle can also affect these channels. These few causes like hormonal stimulation, menstrual bleeding, puberty, these are the main causes that can cause the congenital AV malformation to rupture, veins to rupture at any time during the menstrual life in a young unmarried patient. So this is which I understand what is the cause of heavy bleeding in such unmarried patients that remain silent for years. Look here, now the arterial flow is up to 60 centimeter. So this is also, this blood, high arterial blood is then going into the venous channels, which will show high velocity, high pressure blood flow, that can fragile these vessels. And this fragile vessel near the vein, near the endometrium, can be ruptured during the start of menstrual cycle. So this has happened to this female patient. So I am now going to show you the picture of the anechoic spaces which are starting from the myometrium to the endometrium, from the posterior myometrium. This is the anterior and this is the fundal region. From here also coming and from here also coming and ending at this level. This is the normal looking endometrium. And so when we appreciate such anechoic spaces, we should put the color and then see the velocity of such patient. So this is alarming for this patient because she is unmarried, have no history of any procedure in the past. So I will refer this case for the gynecologist. Mainly we should go for the MRI pelvis or CT angiography if needed to see such uh, better diagnosis, so that this can be decided what should be done in the future for the patient. Mainly the interventional radiologist can help if this thing, as I am saying that this is likely the AV malformation. So if MRI or CT angiography also favor this diagnosis. So mainly, in my opinion, the radiology, intervention radiology can help for the embolization, uh, in my opinion. So first I will refer this case to the gynecologist, and also I will suggest go for the MRI pelvis with IV contrast. This was all about the findings in such patient. So in my opinion, this is the likely the case of AV malformation. Thank you very much.